So today I'll be talking a bit about immunity passports, the science, policy, and technological considerations. So to begin my talk, I'm going to actually start at the beginning of the pandemic. Way back in January, when we first heard about this mysterious virus that was coming out of China. By April of this year, 100,000 people had died, and the full magnitude of the threat had become apparent to all of us around the world. But this threat was not just at the level of health. It was also affecting all aspects of our society. It was affecting our economy. It was affecting our social lives. And one of the first areas affected was sports, as they started to shut down professional leagues and started to have events in empty stadiums. So around this time, I was actually approached by CBC Sports, who asked me the question, how can we restart sports during a pandemic? And I went back to my colleagues at CANImmunize and said, is this something that we could create a technological solution to help with? And we sort of came up with this idea of digital proof of immunity. And the idea would be that individuals may have proof of immunity from serological testing, which at that time actually didn't exist. And they may have evidence of antibodies, and they could be provided with certification that proved that they had these antibodies and were potentially immune. And this could, of course, work for a vaccine as well. And then they could be issued a barcode that would demonstrate proof of immunity. And when they would go to these events, be it a sporting event or a rock concert, for example, they would go and have their tickets scanned, and at the same time, they could have this 2D barcode scanned. And upon scanning the barcode, the person at the gate could verify that they indeed did have immunity or had evidence of immunity. And the individual would have to then demonstrate a government-issued ID that this is them, and then they could be allowed into the stadium. And at that time, I couldn't imagine any other way this could, mass gatherings of tens of thousands of people could be permitted in the absence of the cessation of the pandemic. Around the same time, Bill Gates made this comment about eventually we will have some digital certificates to show who has recovered or been tested recently, or when we have a vaccine, who has received it. And unfortunately, this triggered a fair degree of controversy and a lot of backlash and a lot of crazy conspiracy theories about pandemics and such. But the idea then started to emerge that, is there a role for certification of immunity to help us get through this? Obviously, there have been a lot of concerns with this idea of immunity passports, and I'll just take you through some of these. So the first is, what do we know about SARS-CoV-2 immunity? And that remains an ongoing issue of debate, and the scientific uncertainty does make these type of solutions problematic. So I'm sure there are many attending this who are much more versed in this topic than I am, and this topic again is ever changing. But the basics of it are that individuals get a SARS-CoV-2 infection, develop an innate immune response, then this induces adaptive immunity, which are our specific T cells and our antibodies from our B cells. And then eventually you develop immunologic memory, which allows us to have a rapid response the next time we are exposed. And as you can see from the graph on the right, you get a spike in virus antigen followed by increase in your specific T cells, and then later rise in your antibodies, but these decrease over time, and then that's been the issue. There is a noticeable decrease in antibodies over time, and it is significant. So we did realize and are continue to realize that antibodies are created to the virus but rapidly decrease. And we aren't quite sure still to this date what that means. This doesn't necessarily mean you don't have immunity. This is the expected response. Antibodies do decline over time with any infection. Even at very low levels of antibody, if you have memory cells, you can still have the ability to combat re-exposure. And increasingly, cell-mediated immunity from T cells is being suggested as being an important part of the immune response, and we don't really have a good way to measure that easily. It's also recognized that the quality of antibodies is important. Antibodies directed at spike protein seem to be better at conferring immunity. There's the role of cross-reactive antibodies to other coronaviruses. And then there's the nightmare scenario is the antibodies actually make things worse. This idea of antibody-induced disease enhancement by priming the immune system. So all of this uncertainty did create a challenge with certification of immunity, but as with everything with COVID, we would hope that scientific knowledge would increase and answer these questions and perhaps pave the way to figuring out who actually is immune and who may not be. We have some anecdotal data as well on reinfection, but there's nothing consistent to demonstrate if individuals are at risk of reinfection after having SARS-CoV-2 infection. We know other coronaviruses confer immunity lasting from several months to years. And the Canadian Blood Services seroprevalence study suggested that about 1% of Canadians had antibodies. So we don't actually have a lot of circulating immunity. And that's looking at it from a scientific perspective, but then there have been concerns from an ethical perspective. And I'll take you through some of those outlined in this article in Nature. So one is the issue of privacy, the potential for identification and monitoring. So in that idea of scanning to get into a stadium, well, someone would know you potentially went to a stadium. Obviously, that may not be super concerning, but there are other places we go that might be a bit, we don't want other people to know. The issue of carding, that marginalized groups may be asked for their proof of immunity more than other groups has been brought up. Unfair access, and this would be a considerable issue because testing would not necessarily be ubiquitous initially, and likely higher income individuals would have more access. This idea of social stratification, those that have immunity are viewed differently from those that don't, having privileges associated with it. There could potentially be new forms of discrimination as the idea of measuring biological status extends to other conditions. But I think the one that really people were worried about was this idea of perverse incentives that individuals may want to get infected in order to get immunity, particularly if that immunity allowed them to get back to work and re-engage in life. And this was critical to their being able to provide for themselves and their families. So at a societal level, there were real challenges to applying this, but this is an article in Nature Medicine which modeled this idea of shield immunity. And the concept here is that just like a vaccine can protect some individuals, and by doing so, protect those that are not vaccinated through the herd immunity phenomenon, maybe we can get some shield immunity by interspersing individuals who've been infected and had recovered, presumed immune, and by interspersing them effectively in a cloistered population, we could reduce the transmission from person to person. And this, I thought, was a very kind of a compelling concept for how, in a specific instance, the idea of immunity passports, immunity certificates could be of value. So what does this all mean? So again, from a population level perspective, they're unlikely to be useful, just primarily because there's not enough immunity available, and at least at the humoral level that we can measure, and we don't have a good way of measuring cell-mediated immunity. But there may be roles for this in high-risk populations, areas where social distancing cannot really occur and outbreaks are a risk. And This could include, for example, migrant workers, frontline workers. We've heard about the outbreaks in meatpacking plants. And in these instances, a lot of the ethical arguments that were brought up are actually could be flipped. In fact, if you didn't use strategies that could reduce the spread of infection in these populations, if we knew they were effective, that could be considered perhaps not ethical. But again, this would be in very select scenarios. So as we've all heard the very exciting news yesterday about Pfizer vaccine and the immunity associated with it potentially being at a 90% level. So I guess the question has arisen, if we're not so certain about immunity passports for natural immunity, is there a role for certification of immunity with a vaccine? And we are undergoing perhaps the most unprecedented rapid development of a novel vaccine in history. And we have 11 vaccines now in phase 3 trials. We should be seeing the results of several of those trials in the next few months. And there is an anticipation of a potential vaccine being available at the end of the year or early next year. So this is exciting news. But should we be asking people to document their immunization status? Well, we actually already have a model for this. And this is the International Certificate of Vaccination Prophylaxis for the yellow fever vaccine. And this is outlined in the international health regulations. Individuals are required when they're entering regions that are endemic for yellow fever to have proof of vaccination. And this currently is a paper record, and paper records have substantial limitations. First, they can be easily lost, they can be damaged, they can be misplaced, but they can also be forged and have false information placed on them. So that is a current standard in place, and a discussion is currently underway of expanding the annex that discusses yellow fever vaccination in the international health regulations to also consider a COVID vaccine. How do we move beyond this paper record then for the yellow fever vaccine? Well, similar to what was outlined for natural immunity, a similar approach could be taken for a proof of vaccination that uses a digital certificate. So here's the 4-step process. A clinician administers a vaccine and documents it in their electronic health records. The immunization record is stored in a dedicated repository. A digital signed copy of the record is created and made available to the patient's smart device. For example, it could be inserted into their Apple Health app. A public key is used to digitally sign the immunization record, and this is written into a blockchain system where it can be accessed by verifying agents around the world. And then when a traveler arrives at a border, they can present the barcode containing the digitally signed immunization record, and the border agent can scan this barcode, use the public key from the blockchain to verify the authenticity of the record, and be confident that this individual did in fact receive a vaccine. And the general idea is we want to move from these paper records, which are problematic from many perspectives, to a system, a digital system, which is far more efficient and can be utilized more broadly. Obviously, concerns with digital systems are at the privacy and security level are greater than those at the paper record, so there are some trade-offs. So where do we expect this proof of immunization to first be used? I would expect travel to be the first instance. The gatekeeping would be at the determination of a country of whether they would actually institute requirements for proof of immunization at their borders. But it would be expected that some countries could start to include this as a requirement. airlines might actually make this a requirement for air flights as well. We're hoping that the WHO actually undertakes this and creates standards for this. What would an appropriate proof of immunization be? And the challenge with this is the vaccine will be relatively novel. We will have had decent evidence for phase 3 trials, but there will be multiple vaccines out there, and each of them may have different evidence for effectiveness and safety, and that evidence will change over time. So in this instance, a digital solution would be far better than a paper solution, where a paper solution would say you've received a vaccine, which at the time everybody believed was effective, but let's say 3 or 6 months later, people start to realize it doesn't seem to be working as well as we thought. With a digital solution, that record could then be made invalidated, or they could suggest that the individual must receive a booster in order to maintain that proof of immunization. Even within a country, there's a possibility that immunization records are needed. In Canada, for example, moving from province to province, this could start to become a requirement to waive the 2-week quarantine period. More controversially, we could start to see potential for vaccine requirement and documentation for frontline workers. This is both a legal and technological issue, so it remains unclear whether, what the legal requirements for this could be, but we could see vaccinate or mask mandates. I think initially it'd be vaccinate and mask, but as this evolves, perhaps move to a vaccinate or mask mandate, or vaccinate or stay home. And we actually have an analogy for this with the flu vaccine, where if for healthcare workers, if there is an outbreak on the ward and a healthcare worker is not vaccinated, they're asked to stay home. Going back to the sporting events scenario, you could potentially see gated access to mass gatherings dependent on proof of immunization. We could also see gated access to other venues, and this is where controversy starts to increase. But shopkeepers, restaurant owners may not want to put themselves, their clientele, others at risk, and they also would want to not risk having to shut down. And then employers in general may want to start to track the immunization status of their employees. And again, this is getting to increasing controversy. While mandating immunization would likely not be possible, what could easily occur is that, similar to the hospital situation with the influenza vaccine, if an outbreak or an individual is found to have a case of COVID in a workplace, the employer could then identify all those people who are not vaccinated and ask them to work from home to protect them and to prevent the further spread of the virus. I'm just going to conclude quickly by just a couple of initiatives that are actually currently underway. So this is the Common Pass project, and this is a project working with the World Economic Forum, trying to create common standards for COVID testing and other measures associated with COVID, including vaccination. And the idea is, again, to use this QR code type based system to have a central authority validate that information, that you have had a test and you don't have COVID, or eventually that you have had a vaccine. And the airlines in particular are interested in this kind of solution to help get air travel back safely. The WHO similarly is pursuing an initiative with Estonia, which is a leader in blockchain technology, to jointly develop a digital vaccine certificate to strengthen the COVAX initiative. And so through this process, they'll develop the requirements for this, and presumably this will be embedded in the international health regulations to try to create a global standard and an easily accessible solution for proof of vaccination. But again, just to reiterate, this isn't as simple as the yellow fever vaccine, because there will be multiple vaccines out with changing levels of evidence over time. So we're going to have to be able to document this vaccine at the individual level very precisely. That's going to be important for this purpose. It's also just going to be important for the vaccine rollout in Canada and in all countries in general. So to conclude, this pandemic has affected multiple aspects of our lives: health, economic, and social. Scientists, innovators are striving for finding solutions that can help us get through this, to balance the health and economic consequences and find least restrictive solutions. And in doing so, they will put forward ideas, and necessarily legal and ethics experts will vet these solutions to ensure that they are concordant with existing laws and ethical principles. And I think an excellent example of this is a digital contact tracing app that Canada launched. That in initial conceptions of contact tracing apps, there were significant privacy risks, but eventually the solution put forward of the token-based system, a Bluetooth token-based system, is actually the least invasive of privacy and providing a solution that protects the public's health. Immunity passports, in their initial conception, focusing on natural immunity, I don't believe have an important role to play at the population level, but there could be a real role to play in restricted scenarios, though as described, to provide a form of shield immunity. But where I believe the activity really will be is in immunization passports and certificates. And we should be seeing a fair bit of activity around this in the coming months as vaccines do become available and rollouts start to happen. It will be exceptionally important to facilitate these rollouts, to document immunization at the level of the individual, and then this documentation of immunization could then be used for this idea of immunization passports to provide individuals access to, for example, initially likely international travel, and then potentially extended to other use cases. So I'd like to thank you for your time today. I run the company CANImmunize. If you want to learn more about us, you can go to canimmunize.ca. It's a digital platform that allows you to track your vaccines. We've actually been in touch with the Common Path people to see if we can bring their solution to Canada. We actually made a comic book to teach kids about immunity. It's called Immunity Warriors, and please follow us at Twitter at CanImmunize. There'll be a lot of activity on our side over the next little while.
Thank you so much. That was fascinating. Just checking on the chat. If anybody has any questions, feel free to place them in the chat box, or if you'd like to speak with Dr. Wilson directly, go ahead. Well, I have a question to get us rolling. I'm interested about if there's been any thought put forward for individuals who don't have access to the technology that these immunity passports would be on. Like, if people don't have access to phones or computers, what would the workaround be?
So that's a great point. The backup would be the paper record. A paper record with the QR code on it would be the standard we have now would be likely the backup. I think they are exploring how, I think the Common Path in particular has worked in Africa initially, so they were working with creating the solution to work with mobile phones that have much broader usage. I think this is going to be an important issue moving forward to make sure that we can have the broad access we need.
Okay, thank you for that. We have a question in the chat box from Anna Cohn. Thank you for an interesting presentation. I'm wondering what your thoughts are about the feasibility of immunity passport when we know that there are ongoing and growing theories of conspiracy.
I guess around conspiracies and that individuals may use these in nefarious ways. So my story in CBC Sports was not accompanied by the nicest comments. And then Fox News actually ran it 3 months later, when, as you can expect, the comments on Fox News were even worse. It's challenging. in this situation. And it is important to be critical, but we also need innovators to innovate. And there is a compromise. And that's why I think it's important that the scientists and the technology people work with the law and ethics people. We've been funded, thanks to CIHR and to the Immunity Task Force, to work with lawyers and ethicists to make sure we can design a solution, if there is a solution to be designed, that takes these into consideration.
Okay, very good to know. I don't think we have any other questions. Last chance. Oh, here we go. Apologies if this was mentioned, but how feasible is it to employ blockchain technologies here in Canada, where a minority uses blockchain for consumer purposes?
That's a great question. I was really hoping nobody would ask me a question about blockchain. So I try to understand it, and I've had my technology folks try to explain it to me. And blockchain, to those who aren't aware, is the technology behind Bitcoin. It's a decentralized system, a federated system of connecting individuals and having a verification of a process. So there has been a lot of thought it could be valuable for immunization. It is, it actually hasn't been as useful as people have thought, or hasn't been brought into use as much as people have thought. So there obviously are impediments. So I think that's a good point. This can work without a blockchain solution, but from the people I've been speaking to, they think that's the best way for this to work. And I think that's why the WHO is working with Estonia.
Okay. And then we have a question here from Jen Baker. Can tech be used to track side effects of vaccines on large populations?
Wow, what a great question. So at CANImmunize, we're doing a randomized controlled trial with Canvas right now. Canvas is a part of CERN, the Canadian Immunization Research Network. Every year they do a surveillance of the annual flu vaccine using healthcare workers. We are now embedding their solution within CANImmunize to see if it's roughly equivalent to monitor the safety of the flu vaccine. And Canvas was used to monitor the safety of the H1N1 pandemic vaccine, and could be used for the COVID vaccine. We hope we can help with that solution and make this available to our broader user base.
All right, thank you. All right.
And the Brighton collaboration is also exploring and putting out a document on how mobile technologies can help with adverse event reporting.
Okay, fantastic. And we can distribute in the Slack environment all the information for CanImmunize to make sure that everybody can go see that site and look at what you've been doing. So that's it, folks. We've reached 4:30. Thank you so very much for coming, and thank you, Dr. Wilson, for being here. That was a fascinating presentation. And thank you again, and we'll see everybody next week. Bye now.